Today we will discuss an immunological technique known as radioimmunoassay. This is a technique which is used for detecting the amount of antigen in a given sample. So suppose you have a person infected with hepatitis B and you have the patient's serum in which you want to measure the amount of hepatitis B antigen. And this is an in vitro procedure, that is, it is done outside the living system in a reaction tube or in a test tube. And this technique is based on, or it is detected in terms of the radioactivity measured in this reacting system, either the test tube or whatever reacting system we have. The radioactivity in it is measured, and it is from this radioactivity measure that we get the amount of antigen. So we will go to the principle behind this. That is, in radioimmunoassay, you want to detect the amount of an antigen in a sample. So you want to detect the unknown antigen in the sample. For this, your kit should contain what all? The kit should contain the antibody specific to that antigen. So that is the first requirement. You can call it the primary antibody. So this is the primary antibody which can specifically bind to the antigen which you want to estimate. So that is the first requirement in your kit. Second is a labeled antigen. That means you are trying to measure the hepatitis B antigen. You are trying to measure the concentration of hepatitis B antigen in the patient's serum. So in your kit, you should have the hepatitis B antigen in radio labeled form. So you can call it the radio labeled antigen or the tracer antigen. So that is also a part of your kit. So your kit should contain the primary antibody which can specifically bind to the antigen in question, then the radioactive or the radio labeled antigen which is similar to the antigen which you want to estimate. Now, what all will your reaction systems contain? So first is, in the first procedure, what you do is, you will mix this primary antibody with the radio labeled antigen in your kit. So your kit contains these two components, so you mix them. Now when you mix, you know the concentration of primary antibody as well as the amount of radio labeled antigen. So you are mixing a known quantity of antigen and antibody. You are mixing a known quantity of antigen and antibody. Now what happens? So when you mix them, antigen antibody complexing will occur. That means you are getting a number of antigen antibody complexes. And what are these complexes? They are radio labeled antigen plus primary antibody complexes. Now in the next step, you are adding the patient's serum, which is having the unlabeled antigen whose concentration you want to measure. So this is the second step in which you add the patient sample which will contain the unlabeled antigen whose measure you want to take. Now what happens? So you add the serum. This labeled antigen in your kit as well as the unlabeled antigen in the sample will both be having specificity or affinity to this antibody, to the primary antibody, because the primary antibody is specific to both the kit antigen which is labeled as well as your antigen, as well as the antigen in your sample. The antigen in serum sample will compete for the antibody binding sites. And who is it competing with? It is competing with the labeled antigen. So the serum antigen competes with the labeled kit antigen for antibody binding sites, and here you can see it is now displacing the labeled antigens. Here you can see the labeled antigen is displaced and the position is occupied by the serum antigen. Here you can see the labeled antigen is displaced. Here the labeled antigen is displaced and the position is occupied by the serum antigen. Here you can see the serum antigen has occupied position. Here you can see the serum antigen has occupied position. So what will happen to the labeled antigen? The labeled antigen will be displaced and now it is free. So you can see the labeled antigen is now free. It is displaced. Now what you do? So here, if there was more antigen in the patient's sample, there would be more displacement. But if there was less antigen in the patient's sample, only less amount of labeled antigen would be displaced. So, whatever free antigen or whatever free labeled antigen you have after this procedure will give you a measure of the antigen in the sample. That means, if there is more free antigen displaced, if there is more labeled free antigen displaced, that means there was more antigen in the patient sample. If there was only less displacement, if you find only less free labeled antigen, then that means the patient's serum contained less amounts of antigen. So that is how you correlate it. That is the concentration of antigen in the patient's serum. If there is higher concentration of antigen in the patient's serum, there would be more free labeled antigen. If the concentration of antigen in the patient's serum was less, there would be less free displaced label antigen. So this is the method. So what you should do, how you can measure the displaced antigen. The displaced antigen is already labeled, so you need to measure only the radioactivity. So for that, what you do is, you already have, in the first step you had antigen antibody complexes and all the antigens were radio labeled. After adding the sample, again in the system you have antigen antibody complexes, but in most of these antigen antibody complexes, the labeled antigen has been replaced by the serum antigen. So what you do is, you have to separate the antigen antibody complexes from this free antigen. So free antigens are to be separated, the antigen antibody complexes are to be separated. You can separate them by centrifugation. So when you centrifuge, you will get a pellet as well as a supernatant. The pellet will contain the antigen antibody complexes and the supernatant will contain the free antigens. So what you do is, you can measure the radioactivity of the pellet as well as the supernatant. So you can measure the radioactivity of this pellet as well as the supernatant. So the supernatant will contain displaced antigens which are radio labeled. It will also contain the serum antigens, but you cannot measure them because they are not radioactive. You are only concentrating on the labeled antigens. So when you measure the radioactivity of the supernatant, you will be measuring the amount of, or if there is increased radioactivity, that means there is more displaced radio labeled antigen. You can also measure the radioactivity of the pellet or the precipitate in which you will be getting the antigen antibody complexes. So there is a correlation between the radioactivity measure and the amount of patient's serum antigen. If there was more antigen in the serum, there would be more displacement of the labeled or radio labeled antigen. So the radio labeled antigen, I told you, will be there in the supernatant. So you will be getting a increased measure of radioactivity in the supernatant. Whereas what will be the radioactivity in the pellet? If there was more antigen in the serum, and this is unlabeled antigen, the serum antigen is unlabeled, it would occupy more antigen binding sites of the antibody. So this complex will be having more of serum antigen than labeled antigen, and it is this complex which you get in the pellet after centrifugation. So, the radioactivity will be less. So, the amount of antigen in the serum, the amount of serum antigen is directly proportional to the radioactivity of the supernatant, whereas it is inversely proportional to the radioactivity of the precipitate. So, this is the basic principle behind radioimmunoassay. Now, coming to how you separate this complex from the free or displaced antigen. So, there are a few methods by which you can separate these antigens. That is, first one, you want to precipitate the antibody. So, first what you did, you added the radioactive antigen to the primary antibody, then you added the unlabeled antigen or the serum antigen of unknown concentration. The serum antigen displaced the labeled antigen from the antigen binding sites of the primary antibodies. Now, you want to separate these complexes from the free ones. So, how can you separate them? You can separate them by centrifugation, but for centrifugation this should be complexed, for which you will add a secondary antibody. You can add a secondary antibody by which you can precipitate these primary antibodies. So, then you add secondary antibodies. By the addition of the secondary antibodies, the primary antigen antibody with antigen complexes can be precipitated. Then you do centrifugation. In the supernatant, you will get the displaced antigen, and in the pellet, you will be getting the antigen antibody complexes. Then you measure radioactivity. So, that is one step by one method by which you can separate these complexes from the free antigens. Now, another step is, you can in your test tube, this is your reaction tube, you can pre-coat the reaction tube with the primary antibodies. So, you have pre-coated your reaction tube with the primary antibodies. You added the labeled antigen, the hepatitis B labeled antigen in the kit. Then you added the patient's sample which contains the unlabeled antigen or the serum antigen. Displacement has occurred. The serum antigen has displaced some of the radio labeled antigens. Now, you want to measure the radioactivity in the displaced antigen and the antigen antibody complexes. So, what you do is, you have already pre-coated antibodies to which you have added these two. The labeled antigen is added, the unlabeled serum antigen is added. Incubate. After that, what you do is, first you will collect the fluid here. You will collect the contents of the tube here. So, what will the contents contain? The contents will have only antigens. So, the contents will have antigens in which you can find out the free labeled antigen through radioactivity measurement. Now, as a second step, what you do? After taking all the contents out, you wash this tube. By washing, you can collect the bound antigen antibody complexes. Now, you find the radioactivity of both. So, you pre-coat the primary antibodies in your reaction tube, add labeled antigen, add unlabeled antigen in the serum, incubate, then you collect the contents of this tube first, which will contain the free displaced labeled antigen. Now, you wash this tube to collect the antigen antibody complexes. Then you measure the radioactivity separately. Now, there is one more procedure, that is, instead of coating the antibody on the test tube, you can just couple these antibodies with beads, Cepharos beads. They are gel beads. So, you can use pre-activated Cepharos beads and link them to antibodies. So, you are coupling the antibodies with Cephadex. Then what you do? As the routine procedure, you will add the labeled antigen, the unlabeled antigen in the serum, incubate. Then you do centrifugation. When you centrifuge, centrifuge, what happens is the antibodies are coupled with cephadics. So, they will come down with the pellet and the free antigens will be there in the supernatant. So, these are all techniques. These three techniques are those which help you in separating the free antigen from the coupled antigen. So, what are you concentrating? You are concentrating on the labeled antigen in the supernatant as well as the pellet by measuring the radioactivity. If there is more radioactivity in the supernatant, that means if there is more free antigen displaced, free labeled antigen displaced, then that means the patient's serum contained more antigen. If there was only less displacement, then that means the patient's serum contained less antigen. So, this is the basic principle behind radio-immuno-assay. So, it is used for detecting the antigen. This technique was first developed in 1960 by S.A. Burson and Rosalind Yalow. The principle involves the competitive binding of radio-labeled antigen in your kit and unlabeled antigen in your sample. So, what are they competing for? They are competing for a high affinity primary antibody. So, the labeled antigen is mixed with the antibody at a concentration that will saturate the antigen binding sites of the antibody. Then you add the test sample containing unlabeled antigen of unknown concentration. You are adding them progressively in larger amounts. The antibody cannot distinguish the labeled antigen from the unlabeled antigen. So, the two kinds of antigens will compete for the free available binding sites on the antibody. As the concentration of unlabeled antigen in the serum increases, more labeled antigen will be displaced from the binding sites of the primary antibody. The decrease in the amount of radio-labeled antigen bound to the specific antibody in the presence of the test sample is measured. That means, if the test sample contains more antigen, there will be decrease in the amount of radio-labeled antigen bound to the antibody. So, this is measured in order to determine the amount of antigen present in the test sample. Now, how labeling is done? The antigen is generally labeled with a gamma emitting isotope such as iodine 125 or a beta emitting isotope such as tritium. Then, to determine the amount of labeled antigen bound, the antigen antibody complex is precipitated to separate it from the free antigen and the radioactivity is measured. So, I already told you there are three techniques to separate them. First one is you use a secondary antibody which can precipitate the primary antibody, then you do centrifugation. Or you pre-coat the primary antibodies to the test tube. Then you do all the additions, incubation. First collect the contents of the test tube, then you will wash the test tube and you collect the antigen antibody complexes. In that case, you need not do centrifugation. In the third step, you can again facilitate centrifugation by adding cephadics coupled antibodies. Now, usually in radio-immunoassay, we construct a standard curve by using unlabeled antigen samples of non-concentration in the place of test sample, and from this plot the amount of antigen in the test mixture can be precisely determined. So, we will see how it is done. So, this is a typical RIA standard curve where you want to measure the amount of hepatitis B in a patient sample. So, along with simultaneously what you do is you prepare a standard curve. That is, you are having hepatitis B antigen. You add 200 picogram of this antigen, 400 picogram, 600 picogram. So, you have known concentrations of this antigen and you do the procedure as mentioned earlier. That means, you take, here you have 1, 2, 3, 4, 5, 6, 7 concentrations. So, you have 7 test tubes. In all these 7 test tubes, you have added primary antibodies in equal amounts. In all these 7 test tubes, you add the labeled antigen, the radio labeled antigen in equal amount. Now, in the 7 test tubes, you add the unlabeled antigen in progressively increasing concentrations. So, you know the concentration. So, in the first test tube, you add 200 picogram of unlabeled antigen, then 400 picogram in the next test tube. Like that, you can progressively increase the concentration of unlabeled antigen. Now, what you do? You will do the precipitation, you will do the measurement of radioactivity and you plot it as a curve. So, this means that if there is 200 picogram of unlabeled antigen in your reaction mixture, the radioactivity measurement will be 100 or percentage. This is a percentage in which we express it, that is, it is the percentage of a radioactive compound bound. Suppose there is 400 picogram of unlabeled antigen, then there will be less radioactive. So, you are measuring the radioactivity of the pellet. That means the antigen antibody complexes. There was more displacement, so there was less labeled antigen bound to the antibody and you got a lesser radioactivity. So, with increasing concentrations of antigen, you are getting decreasing radioactivity, and all these test tubes contain known concentrations of this antigen. So, that is how you prepare a standard curve. So, this is your standard curve. Now, what you do is, so you have a standard curve here. Now, you have the sample. You have a sample with unknown concentration of antigen. You repeat the same procedure. That means, you will add the same ml or microliter, or you will add the same aliquot of the sample. Suppose, and you measure the, you follow all the procedure, centrifugation, and you measure the radioactivity. Suppose you get a radioactivity value here. Suppose this is your value of radioactivity. This is the radioactivity which you get. That means the concentration of antigen in your sample is this much, because x-axis shows the concentration of antigen and y-axis shows the radioactivity. So, this is the standard curve. So, you take a sample, you do all these procedure and you are getting a radioactivity value here, which means that this is the radioactivity which you get. So, you will extrapolate it, or you will connect it to the standard curve, and from the standard curve, this will be the concentration of antigen. So, this is how you are determining the amount of antigen in a sample using a standard curve. So, for which you will first, the samples to be assayed are run in parallel along with standard curve preparation. After determining the ratio of bound to free antigen in each unknown sample, the antigen concentrations can be read from this standard curve. So, this is how you use the standard curve. This radioimmunoassay has become a major tool in clinical laboratory, where it is used for assaying the plasma levels of many hormones, drugs like digitoxin or digoxin in your serum, the presence of abused drugs like cocaine, opiates, etc., to detect infectious diseases like hepatitis, HIV, etc., to determine or for diagnosis of autoimmune diseases, and to diagnose the amount of anti-DNA antibodies in a autoimmune disease like systemic lupus erythematosus, to determine allergy, to measure the toxins in contaminated food, etc. So, these are some of the applications of radioimmunoassay. Now, how can you measure radioactivity? Radioactivity can be measured by measuring gamma radiation using a gamma counter. So, this finishes radioactivity. There are some disadvantages of this technique, that is, there will be handling hazards because you are handling with radio labeled antigens. because iodine 131 and iodine 125 can emit gamma radiation. So you require special counters for measuring them. So there are handling hazards because you are handling radioactive material, and sometimes if there is improper handling, if it gets into your blood, your thyroid gland may incorporate this radioactively labeled iodine. So there is such risk, but there are some merits. This is a very precise technique and this is an in vitro technique, so there is no damage to the cells or tissues.